Welcome to the Crown Council Mentor of the Month. I'm Steve Anderson, and I'm excited today to introduce our mentor this month, Dr. Howard Hindin, who is celebrating his 52nd year in dental practice. And Howard, you don't look a day over 21. And so Howard is an acknowledged pioneer in the relationship between dental issues and whole health, whole body health. His research into the dental medical connection and systemic balance is shaping the medical community's understanding of this growing and important field. His practice provides care for all aspects of dentistry with an emphasis on TMJ disorders, craniofacial pain, sleep dental medicine, and physiological restorative dentistry. A little bit of additional background. Howard is the co-founder and president of the Academy of Physiological Medicine and Dentistry, the AAPMD, which is a professional organization for the research, education, and awareness of airway, sleep, and breathing disorders and their connection to chronic disease. He's also the director of the Foundation for Airway Health, which is a nonprofit dedicated to raising awareness about airway, sleep health, and providing education, resources, and access to care for those in need. The foundation enlists all organizations, academies, opinion leaders, professionals, and corporations to unite to bring a unified message about airway health to the public, and we're gonna talk about that today. He is a published author. He, along with Dr. Michael Gelb, who has been a part of the Crown Council for many, many years, is the author of the book entitled Airway Health, The Hidden Path to Wellness. This week, he will be honored in Rome, Italy, with the AAMS, that's a tongue twister, Florence Nightingale Award for Vision, Enterprise, and Passion in establishing the profession of myofunctional therapy. So with that, all those credentials, we welcome Dr. Howard Hindin as our mentor of the month. So Howard, welcome, and thanks for being with us today.
Oh, thank you, Steve. After that introduction, I don't know what else I can say.
Well, you got a lot to say, and I'm gonna ask you to share your expertise and your wisdom with us. So you, of course, know, because this is how we became initially acquainted, about my personal interest in airway health through my own and my family's experiences and the huge impact it's had on my life. My life has been changed by airway health, as well as every single one of my children. As you know, I've had extensive work done, including double jaw surgery. All of my children have had airway-related work done through orthodontics. And it's been life-changing for all of us. So until recently, relatively no one in the medical community was really looking at airway as a cause of chronic health issues. Dentistry, from my opinion, is taking the lead in identifying and helping patients understand the importance of airway health and its impact on total health, thanks in great part to the work that you are doing and have done. So maybe we can start with where we are now. Where is medicine and dentistry in this whole area of identifying and treating airway issues?
Well, it's hard to believe that the whole area of sleep medicine is not more than 30 years old. I think the first CPAP was used in the late 90s. So it's really coming into the areas of medicine and dentistry very rapidly. And we sort of live in the old Wild West of chaos, because now that it's becoming an issue, everybody wants to get a bigger piece of that pie. About 6 or 7 years ago, Michael Gelb and I coined the term airway-centric, because we felt that if somebody has a sleeping problem during the day, they don't breathe well during a sleeping problem at night. They don't breathe during the day well also, and it affects their total life and health and performance.
So I can testify to that.
Right. So Where we are today, it's very interesting because last week I was in Chicago at ADA headquarters. They convened, Steve Carstensen convened the roundtable of physicians, dentists, and researchers. In October of 2017, the ADA issued a statement that dentists should screen for airway problems. They call it sleep-related breathing disorders. But in their infinite wisdom, they never said how that should be done. And so Steve convened a group of about 30 of us, and we tried to come up with what exactly should be the screening for children. And that's where we are now, is the ADA recognizes that this is so important that dentists should be involved and should take a active role. The interesting thing is that the AMA, American Medical Association, and the AASM, the American Academy of Sleep Medicine, issued a statement recently saying that they don't like the encroachment of dentists into the field of sleep because they're not qualified and trained and should be left to specialists in order to do that.
Wow.
So this is so what I view the problem is there are people fighting over who is going to have the biggest piece of the pie. Unfortunately, the most important part of that pie, the person in need, isn't being considered in that equation. For example, in the entire United States, there are only 205 certified pediatric sleep specialists. And if we just take all the major cities, East Coast, West Coast, Chicago,
Not enough.
that's 200. Who's going to care for those people? And so what has happened, in my opinion, we're getting confused between what is certified and what is competent. There are many dentists I know who have spent hours and hours studying in order to know this topic,
Right.
and are certainly qualified. And knowing a little bit about your story, the way you found out about it was from an orthodontist. And I'm not sure whether you went for regular medical checkups, but it was the orthodontist who discovered it. We find and uncover so many cases of people that never knew that their existing problem had any relationship to a sleep problem. So where we are now is everybody recognizes that sleep, quote, airway is important. The question is, what role should different practitioners play? And I am a strong advocate that dentists have to take an important role, not without training, not by taking a weekend course, but if you are competent, compared to 205 certified pediatric sleep physicians, there are 195,000 dentists with seeing patients for a longer period of time with their hygienists and at least twice a year. And if we take that with what's happening, like with your no more hygiene program and periodontal pathogens, we combine that with airway and sleep, the dentist really is the physician of the mouth, and what goes on in the mouth has a huge effect on what's going on in the rest of the body.
Correct. In fact, interesting you should mention the whole the pediatric connection, because that's how mine was discovered. Was I took my children in for an orthodontic, exam and overview and the whole deal. And that's when their airway issues were discovered. And then of course that led to taking a look at the gene donor, which was pretty obvious that because all of them had an issue, it came from somewhere. And of course, my problem was worse than any of them. So, but it started with my children.
Mm.
And so this, in my mind, the whole screening aspect and having practitioners on the front lines who are looking for this and know what to look for and how to address it is huge. And I will tell you, in my case, and Howard, I'm not a clinician, so I know enough now to be dangerous, but it is very difficult for me now to walk through an airport, and I do that every week. I can't walk through an airport anymore without just walking down the concourse and just looking at craniofacial structure. And I know enough now to know who's got a problem without even ever talking to them. You can see who has potentially who has an airway problem just by structure. So let's go from the, from the high level that you just talked about. Tell us a little bit about what you do in your practice. So you and your son, Jeff, have practiced together for many years. I have spent some time in your practice. You are doing some amazing work. Patients come from far distances to be treated in your practice. So at a practical level, tell us what you're doing and how you're doing it.
Well, first of all, we believe that your mouth is part of the rest of your body. And so we don't start with looking at the mouth. We look at the health history, what medications people are on, and we look for those connections. So we look at the airway, we look at sleep, and we also look at the physiology. I think the next step beyond airway is going to be looking at the physiology. We as dentists have a huge influence on what happens with physiology. It's not a question of whether you may want to be involved with airway or not involved in airway. You are, because everything you do is going to have an effect. If you are doing orthodontics and you would do retraction or you take out bicuspids, you are making the airway smaller. If you put implants that are too far palatal or towards the lingual, you are affecting the airway. And so what I think every dentist should know is whatever you're doing, it has an effect, and you should know what that effect is, good or bad. So in our practice, that's what we look for. So every new patient not only has a regular exam, has an airway exam, we'll also look for periodontal pathogens that sometimes uncontrolled periodontal problems are not due to the patient not doing a good job. It's because they have an airway issue. And when you have an airway issue, it increases chronic inflammation. And so the person's response to the same amount of pathogens will be much greater because of their sleep problem. And the amazing thing you'll find that when you identify, treat, and control the airway problem, the sleep problem, periodontal problem improves tremendously.
And again, that was my experience, 100%, is when the airway issue is treated correctly, the periodontal stuff was a natural benefactor of that. They're all tied together. Can you take it a step further? When I was with you in your practice, I observed what was in my mind an absolutely miraculous situation with a patient who has a severe issue with Tourette Syndrome. So you share with us how you're treating that in your practice.
Okay, so Tourette's, there have been anecdotal information that treating Tourette's patients with an appliance, an oral appliance, and reposition their jaw can have a positive effect on the movement disorders, the tics, etc. So a couple of years ago, my son Jeff, who, as you know, is a lot smarter than I am and better looking. It's sort of not fair, but it's okay. It's because he's my son.
There needs to be an improvement on every generation, Howard. So that's a good thing.
So he was invited by Rockland County Medical Center, which is one of the premier medical centers in New York, to do a double-blind study on the benefits of oral appliance therapy with Tourette's. It took about 5 years to get the study, do the IRB, get everything approved. If you haven't ever been involved in a research study and you're a clinician, it's like the dark side of the world, getting everything done right. And so when these patients came in, they had to be videoed from the moment they walked into the office to make sure that we weren't encouraging them, that it was just the effect of the appliance. The results of the study have been fantastic. It's going to be published in a couple of months, and you can see immediately the effect. It's not like go home and wear the appliance. The effects are immediate. In fact, Jeff has this really cool thing. He would ask one of these kids, is there any way that you can make your tics better? And one patient would say, well, I bite on my sweater. And he says, show me. And the patient would take the sleeve of their sweater, put it in their mouth, and all of a sudden the tics would stop. And he said, gee, that's a good place to position the jaw, because the people intuitively know where they should be. And then we've incorporated with that, we've created a physiological monitoring system, again, that Jeff has created, which measures physiological processes. And you were in our office and we showed that to you.
You hooked me up. I got all wired up. It was great.
It gives a whole new meaning to the word getting hooked up.
Yeah.
But so we measure EMGs, muscle contraction, right and left, respiration rate by respiration belts, which measures how the patient is breathing thoracically from their chest and from their abdomen, and it should be equal. A lot of people don't breathe equally. They breathe more from their upper chest and through their abdomen. And then the really cool thing is we measure heart rate variability.
Yeah.
Heart rate variability is a measurement of how our autonomic nervous system is working. We believe we have the most accurate device in the dental market because we measure 2,056 data points per second. And we also have in our system a way to take out the artifacts. And knowing how the autonomic nervous system works, which constantly, every fraction of a second is measuring input from our internal and external environment and making adjustments, and never consults us. It just does it. So we can see when we make a little change in a bite, and all of a sudden, our brain doesn't have to work so hard to figure out where am I in space. That makes a big difference. And we can take somebody else's appliances and just tweak them a little bit, and you'll see immediately the change that'll happen. And so we've created something called the physiological bite. Instead of taking a TMJ or sleep appliance bite based on phonetics, how somebody is speaking, or in sleep they say, well, you take 50 or 60% of protrusive. We put the person where their physiology, their body wants to be, and that's where we make the appliance to. Really cool.
So would you say today, because you're doing a tremendous amount of restorative dentistry, cosmetic dentistry, you've been doing this a while, is your treatment protocol based on airway out? I mean, you look at the airway first and everything else follows. Does that simplify it too much?
No, I mean, that's great because, as I said earlier, that Michael Gelb and I created the term airway-centric. Airway-centric means airway trumps everything, airway first. Don't look at the models before you look at the airway. Don't look at the anything else before you look how the patient walks and moves. People change their posture in order to support their airway. Tilt their heads, turn their foot out. And so that if you are doing restorative work and putting teeth in a position in that unbalanced body, you're just helping support their unbalanced position better than it was before. Some of the times, the reason that dentistry breaks down in the first place is we're trying to rebalance ourselves. And then we take these worn, broken teeth that are sort of getting us where we want to be in balance, and then we're taking them away and putting beautiful, unbreakable teeth back in an unbalanced position. Once you understand that, you can never do it another way.
All right, so there are all different levels of knowledge and expertise of those who are listening today in terms of Airway. Some that have done little, some that have done a lot. Based on all of the work that you've done in both dentistry and working with the medical community, what would you say today is, I don't know if standard of care is the right word, but what is every dentist's responsibility today as you see it in terms of the whole Airway issue and where we're going?
Okay, so we are on the cusp of change with the ADA statement in October. It is rapidly going to be the standard of care that dentist has to look in Airway, just as oral cancer screening has become the standard of care. That was never the case when I started in practice. Looking at periodontal disease and the connection to systemic health is becoming the standard of care. And that's where we are. So right now, a dentist would not be held at fault for not recognizing Airway, but that's going to be changed. I don't think we should wait. But more important, looking at it from the patient in need side, even today, only 15% of people with an Airway problem are recognized. And I know that I could walk into anybody's practice and I could find 50% of those people in that practice who have an Airway problem that needs treated. And not only are they not being cared for, and one of the things I always hear is, why hasn't anybody told me about this before?
Yep.
And you can agree from your own point of view that
I can.
Absolutely. How many offices you've been to and nobody ever said you have a problem. And when you realize there was a problem, it wasn't a borderline problem. You had a big problem that you were walking around with. Because if it's an Airway problem, well, I'm breathing. I mean, you were certainly breathing before. And you had high functioning, successful. So the people we think of, fat, overweight, people who have trouble breathing, those aren't the only people with a problem. A lot of women with slim women, they don't express it. It's not always apnea. It could be something called upper airway resistance syndrome, where there really aren't symptoms that would jump out of you. But if you ask the right questions, and there are always signs of a problem. Airway and sleep problems have now been linked to cardiovascular disease, diabetes, Alzheimer's, and even cancer. And in children, it's been linked to ADHD. Steve Sheldon, who is a friend, head of sleep medicine, pediatric sleep medicine, Lurie's Children's Hospital, Northwestern University in Chicago, says up to 80% of children diagnosed with ADHD may really have a sleep problem. His video is on our foundation site. Anybody can watch the video of that interview where he says that. Why is that important? Because last week, there was a medical report that says ADHD in our population has now reached 10% of our children. And I can guarantee you that only a small fraction of those children are ever even asked if they have a sleep problem.
Right. Well, and a lot of times, even if you do, you don't know.
That's
you don't
right.
know. I mean, how does a child know? I was asked consistently by my family dentist as a child if I was grinding my teeth. You don't know that you grind your teeth because you do it in your sleep. You don't know that you got a sleep problem. So,
and interesting you mentioned that, because bruxism is a symptom of an airway disorder. In fact, that before every apneic or lack of breathing event at night, there's a bruxism event. And
And I had
so,
that all through my childhood. And of course, that was long before anybody knew the connection. But
a patient who comes in always breaking the porcelain on crowns,
yeah,
uh, you can't get the bite right, or complains about the previous dentist, and you're going to make better porcelain, or your lab is better, and you haven't checked an existing airway problem, you're just going to be the next one in line who hasn't treated them right.
exactly. All right. So certainly plenty of work to do, and we can see where things are going. Talk to me a little bit about how dentistry can have a meaningful conversation with the medical community at the practitioner level. You've done a great job of bringing both groups together. For a dentist who's practicing in any town in America, how do you initiate a meaningful conversation about airway with family practitioners, with ENTs, with the medical community in general?
Okay, so if we just take it as a step from what you've already done with your no more hygiene, physicians now either know or are learning about the connection between periodontal problems and oral health, and it's the same thing. When a physician is resistant to the conversation, it's probably because they don't know.
Mm-hmm.
And so you want to educate them and open the door to a good relationship. In the current state of, I don't think a dentist should solely individually make a diagnosis of a sleep problem. If the way it should work is you identify a problem, you've done screening. In some states you can do a home sleep test, in other states you can't.
Right.
But you need a physician to work with, because number one, it is a medical diagnosis. Number two, that the patient is often on either one or more medications that will be affected, hopefully positively, by being treated. And let's say they're on blood pressure medication, you help their sleep and their blood pressure goes down, that has to be adjusted. You're not going to, as a dentist, you are certainly not going to do that, but it can be very rewarding. And then also the other fact is sort of this battle between, well, what's better, an oral appliance or a CPAP? We have patients who have both. It doesn't matter which. It doesn't matter which is better. What's better is what works for that patient. Some people can do very well in oral appliance, and some people can't, and vice versa. You know, one of the problems with CPAPs is, if you're a Medicare patient, in order to keep your CPAP, you have to use it. What does that mean? It means you have to use it 21 out of 28 days, 4 hours a night, which is 35% of the time. And so obviously they've set the bar so low because compliance isn't really very good.
Not high.
And so now you need to establish a relationship, because treating sleep, even if you do make an appliance, that's not the end of treatment. That's the beginning of the treatment. An appliance is a Band-Aid. A CPAP is a Band-Aid. There are patients who choose to wear that Band-Aid for the rest of their life, but there are a lot of people, you especially, who don't want to be married to an appliance or a CPAP for the rest of their life. So there's orthodontic solutions, there were restorative solutions, there are surgical solutions. So once you get involved in airway, it's a physician-dentist partnership to lead that person back to better health. I just want to mention a great book that came out in the last year called The End of Alzheimer's, written by Dale Bredesen, Bredesen. And he has now reversed, I would say, 300 to 400 cases of Alzheimer's with his protocol. What's his protocol? It's not a miracle drug. It's finding all the aspects that are causing chronic inflammation. And he calls it 36 holes in the roof. if somebody has a problem, you can't just identify one or two of them. You have to identify all of them. What is cool about it is we as dentists have several of those holes in the roof that we are responsible for. Sleep and airway, periodontal pathogens, metal toxicity, occlusal stress. We have those, but we don't have them all. And the only way we are going to effectively treat this is by collaborating with other practitioners. And it's exactly the same for cardiovascular disease, diabetes, cognitive loss, and probably they're going to find even cancer. And so collaboration is not only important for your practice and not getting into trouble legally, but again, what are we here for? To take care of the patient. We can do so much of a better job and get optimal care if we collaborate together.
So let's talk about what we can do today. So depending on where somebody is in this whole journey, it's very clear to me, and especially based on what you said, very clear where dentistry is headed. This is one of the biggest changes that's on the horizon in dentistry, that it's going to become a huge, huge part of what dentists do. So what would you recommend that a dentist do today, regardless of whatever experience they've had in this area? What are some basic things that you recommend they do?
The number one thing would be learning how to screen for a problem.
Okay.
You can go to, there are screening tools on the Foundation for Airway Health website. We can probably give the listeners that email address at the end.
Okay.
There are online, there are a lot of courses being given. The number one thing is start recognizing those patients in your practice who have a problem. It doesn't really add a lot of time to exam. More important than that, train your hygienist to do it, because a lot of the recognition will come from just asking the right questions, which aren't being asked. Nobody spends more time with a patient in a year than a hygienist.
Yeah.
And they have, just looking at the health history, anybody who has a chronic disease or is taking certain medication, then you would know. Then you look for certain things, a scalloped tongue, you can't see the back of their throat, nasal breathing, narrow arch. It doesn't even add a minute to an exam to recognize it. What's the next step? Do you want to do more complete diagnosis in your office? Fine, then become competent and do it. If not, refer to a physician. I think that every dentist should at least know how to do a full workup. Every dentist should know how to do a full workup and have a relationship with a physician who can make the diagnosis, and learn how to make some basic sleep appliances. There are now almost 100 approved FDA sleep appliances, all colors, racing stripes, wings, and fancy things. Find a couple that you want to do in your office and get started. But I think the number one thing is don't do a big restorative case unless you've looked at the airway problem, because it's going to come back to, not only come back to bite you, but it may not. It'll just affect the patient's health for the rest of their life.
Huge impact.
And then take courses. And I will personally, anybody on this call, on this podcast who has any interest and wants any more information, you can give them my email address, and I will be happy to mentor them in any way possible, because this is my passion. I want to change that 15% diagnosed to 50% at least in the next couple of years. And it's never going to happen unless the dentists do it.
So a couple of things that I will re-mention. Your book entitled Airway Health, The Hidden Path to Wellness by Dr. Howard Hindin and Dr. Michael Gelb. You can get that anywhere online, correct?
Yeah, but the title of the book is Gasp.
Gasp, there we go.
And I love the title. I think it's great. And we call it the hidden problem because it is hidden. The people are amazed when they find, oh my God, I didn't know I had a problem. Books are doing well. They're selling well. I'm not going to give up my day job because I'm an author. But every single month we get calls from somebody. Thank you so much for the book. You've changed my life. The book was written for the public, but it's a great book. We have practitioners who give them out to every new patient who instead of going through the whole explanation, people have passed the book on to other people in their family. So that's great. It's on Amazon.
Give the correct title of the book again is
Gasp, the hidden key to wellness.
Perfect. All right. Second, give us the web address for the Foundation for Airway Health.
So Foundation for Airway Health is airwayhealth.org. So the foundation was created to be a partnership, public practitioners and companies working together to raise awareness and to the public. So the foundation is mostly geared to the public, and we just are putting in a new program called the Airway Advocate Program. Airway Advocate Program is, we had a program called the Airway Pledge where people can just come online, sign the pledge, say that they will screen every patient for an airway problem and then be listed as a resource. So we've changed that. There's going to be a small fee attached to being an airway advocate, but we now have 5 or 6 companies as part of their partnership will be giving benefits to anybody who becomes an airway advocate. And those benefits are worth thousands of dollars to doing their share. And we want our patients are being airway advocates, just like you mentioned before. You can't go through an airport without noticing people with a problem. Yeah. That our patients are the same way. They say, I noticed my my niece can't close her mouth. She's breathing through her mouth, and my grandson stuck out his tongue, scalloped tongue. And so if everybody works together, we have all these incredible missionaries, and working together. I go back to your teachings. You have to change the culture. Doing airway is not adding another procedure to your practice, how to do a better crown, how to do an implant. It's changing the culture. It's looking at the patient as not as a dental patient, as a person who you are going to help make their life better. And with the tools that we now have as dentists, we can really make people's lives better. But everybody in your office has to be part of that cultural change.
So thank you for those 2 resources. The book, airwayhealth.org, which has some great resources. I was very privileged to have the opportunity to speak at the AAPMD meeting. And I will tell you, Howard, I learned more just by sitting there and listening to the other presenters than I think I taught. Hopefully I shared a few things that were of help, but I learned a tremendous amount just from the resources that you brought together there. Tell us real briefly about the meeting, what it does, and what a dentist would get out of it.
So our next meeting coming up, November 8th to 10th, at the Red Rock Resort in Las Vegas. And so, as I mentioned, teamwork and collaboration is a key. The other thing that's been happening in the dental meeting arena is that there's so many meetings, everybody competing together. So I reached out to another group, which you're familiar with, Steve, AOSH,
Yep.
American Academy of Oral Systemic Health, and I think you're involved as an advisor to them.
Mm-hmm.
And a third group, which is called ACAM, the American College for the Advancement of Medicine, which is a medical group of integrated physicians. I said, we should do our meeting together. And so this meeting will be a meeting of the three groups. We're holding our meetings jointly. We have some different tracks, some combined programs. We have a couple of interesting things. We do foundation. We're going to have a white flag event on myofunctional therapy. What is the future of muscle function in airway health? And so we have invited, I think, 8 to 10 of the world key opinion leaders to give their view of where we are now, where we're going in myofunctional therapy. Another workshop is going to be with an incredible physical therapist, Rana Ruska, about how the position of the neck and posture relates to airway and occlusal function. Then we have things on cardiovascular disease, Baldonine. We have Christian Guilleminault, who's the father of airway medicine, and Gerald Simmons, a neurologist. So we have something for everybody. And because it's a 3-in-1 meeting, if you sign up, register with the AAPMD, you can go to any of the classes, any of the presentations of any of the groups, no additional charge. We also have a joint reception, and last time we had this great closing reception where we arranged the tables according to geographical areas. So you ended up sitting with practitioners of different modalities so that you could take home contacts so that you can begin to build your own pod or network of practitioners. You know, like we talked before about how you communicate with physicians. Wouldn't it be nice to get a sort of like physician dating or something like that? And so,
very cool.
So what we're trying to do is provide education. When we say learn what you do and do it better, but also learn what other people do that you don't do, who they are, how do you connect with them, and nobody's really taught how do you collaborate, how do you play together on a team. So that's what we're trying to do, is how to put together how you collaborate, how the patient goes from one person to another. Do the collaboration at the beginning. A lot of people define collaboration as, well, when I don't know what to do with the patient anymore, I'm going to collaborate with somebody and send them to them. we think it should be done at the beginning, and so we're excited. We have, as of now, all our exhibit space is sold out. People want exhibit space, 70 exhibitors.
Wow.
We have over 600 people, 650 registration for the meeting. Our goal is to get to 1,000, because getting to 1,000 will show that our message, the message of collaboration, working together, and the dentist is not just the appliance maker for physicians, that the dentist is incredibly competent, and with training, we own this territory. The mouth is our territory, and we shouldn't be subjugated to being technicians for the medical profession. So I want to encourage all the Crown Council members to come. It's not far. It's our last meeting in Puerto Rico, we got killed by the hurricane.
Yes, you did.
I can guarantee no hurricanes in Las Vegas.
And if there is, we're going to have a lot bigger things to worry about. All right. So the website, give us the address for more information and to register for the meeting.
www.aapmd.org, which is and all you got to do is click on the banner. We'll take you to the website. And because I think that the Crown Council members, because they are like leading clinicians in dentistry, are great audience to be more involved in Airway. They would be great missionaries for the message we're trying to provide, and we have provided discount code 2018 SAC, which stands for Steve Anderson, Crown Council.
There you go. Okay. So so when you register, if you put in 2008 SAC,
you get a $200 discount off the registration fee.
As long as you don't use that extra money to go gamble, right, Howard?
Of course.
Very good. All right. So let me do a quick review as we wrap up. Your book, Gasp, which you can buy on Amazon, ought to be a must read for everybody that has any interest in airway health. The Foundation for Airway Health, airwayhealth.org, which has resources to help start screening and diagnosing airway issues. And then the AAPMD joint meeting at aapmd.org, and you can use the discount code 2008 SAC for a special Crown Council discount.
2018.
2018, not 2008, it's 2018. 2018 SAC, perfect. Dr. Hindin, thank you for sharing your wisdom and everything you're doing. I will add this this closing comment, which we have not talked about. And one of the things that I admire the most about you is not only the work that you've done and continue to do, but your passion with which you do it. And that is what life is all about. You and I have never talked about this, but I know that you could very easily be basking in the sun down in Arizona or some tropical paradise someplace, relaxing in retirement, and you are doing something far more worthwhile, which is changing and saving lives and making a difference in the world. And for that, I personally thank you and appreciate your example. So thanks for sharing your wisdom and everything you're doing with all of us today.
Well, thank you, Steve. Thank you.
Have a great trip and congratulations on your award in Rome. And I know you're going to have a great week this week. Thanks so much.
All right. Thank you, Steve. Bye.